Right. Anyone that already joined us is here. So thank you for spending your time with us here in the PelviGain Masterclass. Hello and welcome to PelviGain Masterclass, where our goal is to eliminate leaking and reclaiming our pelvic floors for good. We're going to dive in and we're going to figure out how we can do that with all the support that you need through Women's Tribe. Why pelvic gain? How did we get to pelvic gain? Well, first, let me introduce myself briefly. My name is Susanna Wuchank. My background is in physical therapy. And as I was active in national health promotion programs in the early 2000s, and I got to work with many of the different groups, I recognized that when it came to women, there was this common thread throughout. Women were struggling, and that was women of all ages, all backgrounds, and all life stages. And so I decided to enroll into prenatal postpartum corrective exercise specialist program. And that was about 20 years ago. And I've been incorporating all of that knowledge, all of those new gained skills at the time into every facet of my health coaching, being a fitness nutrition specialist, and just about any area of my professional work with adult women. Also, as I worked with a lot of senior women, and those were actually my first group that I got to work with, I could recognize some patterns. And it was happy and joyful women were the ones that were actually healthy and active women. And that really triggered my curiosity. Is there something about it? Is there something that I can do about it now? So as I age, yeah, I know it sounds very selfish, but as I age, can I be like them? Because also in the hospital setting, I got to see all of the frustrated women, all of those women that were suffering immense pain for decades. And I got to see that future as an option too. And I thought, there must be something more to life than just suffering and continuous pain. And so these women have become my life goal. And even today on social media, you will see me following not the young influencers, posing beautifully and barely anything at the gyms. You will see me following the influencers that are 75 years old, lifting weights, going to the beach, loving their gym and fit and healthy, active lifestyle. And you will see me commenting with hashtag goals all the time. Those are the kind of women that I aspire to become. And so, as I was blessed to work with these women, either in healthy spine program, osteoporosis prevention, weight loss, whichever program we worked on, we would always say, so many people tell us that wearing diapers as a senior is just a fact of life. And so let's just rebel against that. Let's be those rebels and start a diaper prevention program. And that we might start as well sooner rather than later, right? Does that sound something that's interesting for you? Is that something you would want to do too? Please let me know. I'd love to know that we're not alone. Let's build up this tribe. And of course, life happens, and so many beautiful things can happen in life. And well, you can see two of those on that picture. Well, that guy also, the handsome boy. I got to I was blessed with two beautiful boys. And during the last pregnancy, the baby was just huge, chunky baby. And I would carry him all the way to the front. My belly, I just had zero control of it all of a sudden. And when he was born, he weighed almost 10 pounds. And so ever since, everything that my body had gone through, things have not been exactly the same. And it's become a little bit of a challenge to control everything that's going on in my pelvic area. And so, what I've learned throughout the years is yes, you can retrain the muscles, but also when you don't train them consistently, if you've gone through a long cold or if you've gone through an allergy season, you've been sneezing and coughing a lot, even after a week of that, you will feel the need to cross your legs. And your body will go, well, your pelvic floor in particular will go, hey, lady, you haven't done your exercises in a while. How about you get back to it? Because I just can't hold it anymore. And so there's that kind of a selfish aspect too, why there was the need to develop the PelviGain and implement it. And so, all the successful people will say, if I can do it, you can do it too. Well, in my opinion, it was, if I can retrain my pelvic floor muscles, then anyone can. Because A, it's not that hard. B, we need to do that because nobody wants to wear pads for life or even diapers for life. And so there are so many ways where we can achieve that. And so that has kind of intertwined into the mission and vision of the women's tribe because we truly believe that every woman deserves the empowerment and confidence about her body and the way she carries herself and the way she gets to socialize and not stay inside because she's worried that there's no bathroom nearby. And she gets to do everything she enjoys doing by safely ditching the pads, being able to jump with kids on trampoline and not worrying about sneezing when she has to. And she gets to live that full life, worry free life. Now, if we want to achieve that, I'd like to see a raise of hands. I'd like to see the comment section over flooded with your comments. How many times has it happened for you or someone that you know, a woman in your life that you know, that when you or she went to the doctor and they would say, listen, I'm experiencing this and it's kind of embarrassing if it happens all of a sudden and I have no control of it and it's been becoming more and more frequent. And like, how many times have you heard back, well, it's because you're aging, or, well, we can't really do anything because you haven't had babies yet, or, well, this is what happens when you're an elite athlete. Maybe you're just working out too hard, or, well, you're a woman, so it's very typical. So all of a sudden, you just feel, well, I'm complaining about this. I'm sharing this very intimate, kind of embarrassing concern. And I'm hoping that I could get some resolution from it, some pointers on what it is that I can do. I'm trying to be proactive, but I'm getting disregarded. Maybe it happens not just by the medical professionals, but also by other women in our lives. And so, what we want to do is educate everyone. And once we get to educate and connect with everyone, we can spread the message. We can let everybody know what is happening, and hopefully, we can resolve it. When we look at this picture, you're going to tell me, hey, is there going to be TMI? Well, I can promise you there will be TMI. We're going to learn, we're going to dive deep into all the subjects. We're going to learn as much as we can so that we can normalize these conversations. We can start talking about what is happening with our body, why what is happening, and how we can troubleshoot that and resolve it. And so, with that, we do need to start with the role of the pelvic floor muscles in our body. So, what we can see here is that the pelvic floor is a group of 28 muscles. They can form a sling like structure, or if you want, a bowl at the bottom of the pelvis. And these muscles support the organs located in the pelvis, including bladder, uterus, and rectum. And the pelvic floor muscles play also a crucial role in controlling your continence, so your urine and your bowel movements. They also support our posture and sexual function. According to American College of Obstetricians and Gynecologists, pelvic floor dysfunction is something that happens when these muscles are either too tight, not strong, but too tight, or too weak. And they can become weakened or damaged due to a variety of factors. And we're going to cover that in the next few minutes. And what they say is that it is a common problem that affects women of all ages. And if we're quite fair, I did post, like, I placed a picture of a female pelvis floor muscles here, but it happens to males too. So you will know that men struggle with certain issues, especially when it comes to hitting that middle age or even later. And it's not surprising that even 30-year-olds can experience that too. But for the sake of this topic, this master class is aimed at women. This is a women's Facebook group. And so we're going to say, we're going to talk about mostly about women, right? But don't be surprised if you have a guy in your life that struggles with pelvic floor too. Now, these are some of the causes of pelvic floor dysfunction. And just like I kind of touched on all of this earlier, um, yes, there are many factors that can contribute to that. Sometimes they're going to say it's genetics. Oftentimes, the doctors will say, well, you've had five babies, so, wear the pad. So, yes, pregnancy and childbirth can have an impact and be a cause because the pelvic floor muscles can become weakened, sometimes even damaged during the pregnancy or childbirth, especially if there was a C section, if there were tears, if there was episiotomy and if there was kind of a difficult delivery. Aging, as women age, the muscles and tissues that support the pelvic organs can weaken, and that can lead to pelvic floor concerns. When we talk about aging, we need to mention menopause as well because changes in hormone levels during menopause can lead to vaginal dryness or thinning of the tissues, and that will lead to pelvic floor disorder. I'm sure you've gone through certain periods of time when you coughed all the time or you had to sneeze all the time because of allergies and you would need to cross your legs as I've said before, or you would need to grab on the bottom part of your tummy just so that you could support your pelvic floor. And that chronic cough or sneezing can put a lot of pressure on the pelvic floor muscles and weaken them. Obesity has a similar mechanism. So, excess weight will apply too much pressure to the pelvic floor and weaken them over time. So, this isn't something that just happens overnight, it does take certain time. We have to touch on medical conditions too, because we've had some questions of some of the ladies here in the group and of course, any kind of medical conditions that pertain to the nervous system issues, such as multiple sclerosis, spinal cord injuries, that will lead to pelvic floor dysfunction, but also surgeries such as hysterectomy, or if someone needed to have a lot of surgeries because of endometriosis. Usually, there's not just one procedure that they go through. It is a difficult diagnosis to navigate. So that can, anytime you need to have a surgical procedure, that will kind of create a shock to your system and will weaken the muscles. We've talked about straining and applying a lot of pressure to the pelvic floor organs, and that can happen also when we're constantly constipated. So, making sure that we have regular bowel movement will help alleviate those issues. Psychological stress is not to be disregarded, but then also the physical stress or trauma. We mentioned vaginal birth, we mentioned C section, but then also falls, something unexpected where we couldn't really brace ourselves and prepare ourselves. And then high impact sports. Pelvic surgeries that I mentioned already. I didn't say hysterectomy, but that goes under that too. All of that can lead to weakening the pelvic floor muscles. What I'd like to stress here is that it's important to note that the pelvic floor concerns are common and can affect women of all ages. So if you have a 20-year-old in your life that is dealing with a pelvic floor disorder, let's not disregard them. Let's try to figure out how we can support them, how we can help them, who we can help them get to so that they can have a proper conversation and find a solution for them. But also, you know, as children, we used to laugh at senior ladies. They would be in their 80s, 90s, and so on. And, they would be gassy, and we would just kind of giggle, would go, oh, she doesn't even know she's doing it. Well, she probably knew, but she's just had zero control over it because she had zero information that she could, even in her 80s and 90s, strengthen the muscles and make sure that, nothing leaks when it's not supposed to. So, while some women may be more at risk due to pregnancy and other factors, anyone can experience pelvic floor concerns at any point of life. And it is important. That's the first thing that I will emphasize throughout this masterclass is to seek medical attention if you're experiencing symptoms of pelvic floor concerns and find treatment that can help alleviate symptoms and prevent further complications. So, the most frequent things that we need to cover today is we need to talk about the most common pelvic floor concerns amongst women, and that would be urinary incontinence when we leak urine without being voluntarily, fecal incontinence. So, bowel movement, it happens that we pass too much when we're not supposed to, pelvic organ prolapse, and pelvic pain. These are the most common concerns, but they're also symptoms of pelvic floor dysfunction. We started with incontinence, and someone said in the questions, how do I know I'm incontinent? I've mentioned it a few times before, so I'm going to touch on that again. If you've had a long period of having something chesty that would irritate you all the time, sometimes it's connected to allergies to certain foods and other irritants. But if you've had a cold and you've had a lot of phlegm or a lot of that dry cough, that cough seems to go on forever, right? Even after you're feeling 100%, you're still coughing. So, over a certain period of time, your pelvic floor cannot take it anymore because that's just continuous pressure to the pelvic floor while we're not strengthening those muscles knowingly or thinking, we don't know that we should. So, they will weaken. So, it's important that we don't lose any droplets in that time. We still want to activate the pelvic floor whenever possible on a regular basis. And then, so we talk about involuntary loss of urine, which can occur either when we're coughing and sneezing, but it can also happen when we're during certain activities. And then fecal incontinence, that would be inability to control bowel movements, which can result in the involuntary passage of stool or gas. So if that happens all the time, we need to find some kind of support. Pelvic organ prolapse, it would be quite a serious condition, and we want to address that as soon as possible. And that's a condition in which the pelvic organs, such as uterus, bladder, or rectum, can descend into the canals due to weakened pelvic floor muscles. Oftentimes, women will mention the uterine prolapse. They will say that there's bulging and there's pressure or there's feeling of heaviness and like something's going to fall out. That's literally how it feels. And this is where you really want to seek help and you want to make sure that you're doing all the correct things, the correct kind of exercises. And there are ways to alleviate some of that pressure too through certain positions that we can cover in the 5-day mini course as well, if you'd like to. So, seeking help, again, I will repeat myself a lot, but we do want to get help as soon as possible and get everything back in its place as it should be. Pelvic pain, this is a symptom, but it is quite difficult to diagnose because you need to pinpoint where exactly the problem is. You need to figure out why there is pelvic pain. You don't just want to mask it like a band-aid, on top and, just, oh, let's take a painkiller and you'll be better. But you also want to figure out why this is happening, especially if it's repetitive. So with the pelvic pain, you can either experience that in your low back area. It can happen due to IBS. It can be experienced in the bladder area during your pelvic exam when you go to your OBGYN. And with certain people, it can even be when they're trying to be intimate during the intercourse. So women will say that they can feel it in their lower abdomen, in pelvis, in their vagina, in the external area, that would be your vulva, rectum, or bladder. And this pain may be present constantly, intermittently, or with certain activities, including exercise, or if you need to sit for a long period of time and you just need to get up and walk it off. And I mentioned the sexual activity. The pain is often described as achy, heavy, or burning in nature. And it generally comes and goes over time. So again, it becomes tricky to diagnose because, you may be just going to the doctor and you don't feel anything at that point, and you're thinking, they're going to think I'm crazy. Pelvic muscles often have these discrete knots. You know, when you touch your shoulders or if somebody rubs your shoulders and they find a trigger point, and if they massage your shoulders, you feel good, you feel better. But if they press on the trigger point on that trapezius, that can result in pain, and you shrug your shoulders and you're like become all tense and you can't handle it. So this is something that you can feel from within the pelvic floor as well. So if you're having a pelvic exam or during the intercourse, those trigger points can be triggered and it will result in pain. And you can experience even symptoms such as heart racing, sweating. Women say they become tearful or cold, or they can even get a runny nose, right? It just seems so unusual, but these all relate to pelvic pain. Now, symptoms may be referred to other areas. They will manifest in different ways, such as having to urinate frequently or suddenly, right? You're all feeling great with your partner and things start to happen and then all of a sudden you need to run the bathroom, or you have burning with urination, or even experiencing vaginal or vulvar itching and burning. So often we hold this stress subconsciously in our muscles, and that will apply to the pelvic floor area too. It's not unusual. So if you think, I'm trying to sit up tall right now and you can do this with me. If you sit up tall, and you know how sometimes you can really tense up, and all of a sudden the rest of the body becomes very tense too. We're going to do a little exercise, and I'm going to lead you out of that tension too. So, you want to sit up tall, you take your shoulders back, you can breathe, and you let your hands fall down by your side. You will create a fist, strong fists, and you're going to flex your arms like you're flexing your biceps. Your wrists are coming to your shoulders as you're flexing, and you're very, very, very strong. And yes, I'm doing this with you. So I hope you're doing this with me. And you're just very, very strong. Your biceps is incredible. If you're activating both of them, even better. And I want you to pay attention as you breathe, of course. What are the other areas that are becoming very, very tense? So your biceps is strong, but what is becoming tense? Where do you feel that tension? Is it in your wrists? What's happening with your fingers? What's happening to the opposite side of the biceps? What's happening with the triceps? And then what about the tension going up to your shoulder and your neck area and under armpits? And you're so strong, you're probably getting red in the face, especially if you're not breathing, which I hope you are. All right. And then we're going to release. Take a deep breath in and exhale. And as we release, we also release the fingers. We don't have any fists anymore. Try to relax the shoulders, they fall down. We carry on breathing if we need to take a few more deep breaths, just to let the body know that, hey, everything is okay. We can let go of that pain. Okay. Imagine that you've been clenching your muscles your entire life. Not just this biceps for 10 seconds or 15 seconds that we did, but someone told you, and again, let me know in the comments if you're watching this, whether you're watching a replay or watching this live. Let me know if you've ever been told as a woman to suck your belly in. You need to have a flat belly, and you're sucking it all in, right? Or you want strong glutes, so you're just clenching your glutes all the time so your backside is nice and perky and strong and all that. With all of that, we're creating a lot of this associated tension in our pelvic floor area. How does that feel? Does that make any sense? Does that explain anything? So, when we're subconsciously holding this stress in our muscles, either because of what's happening in our lives or because people told us to be strong and suck it in and all that, This prolonged muscle contraction may result in decreased blood flow and oxygen in the tissue. You know that when you unclenched your fists, you could feel warmth in your fingers all of a sudden. Did you? I know I did. So, when you reduce the blood flow and oxygen to the tissue, this in turn causes release of substances from the brain that cause pain and can even change how pain is perceived by the body. So you couldn't feel pain in the biceps because that was strong, but you could feel the tension everywhere around it. So this ongoing pain in one area may cause the central nervous system to become overly sensitive. So if you do this repeatedly, your nervous system will go into panic mode because the brain said, hey, this lady could have relaxed, but she didn't know how. She didn't know it was time to let go. So now the nervous system is in continuous fight or flight mode, and it can magnify the perception of pain in another area. So even if you have a very gentle partner, you could go into panic mode and you could feel bad about it and think, he's amazing, he's great, or my doctor is really gentle, but I just respond this way. I don't know what's wrong with me. Well, something happened or something was happening repeatedly over a certain period of time that created a lot of tension. So, all this clenching, all of us trying to look great because of the social norms could have led us to this situation. So, if you are experiencing any symptoms related to your pelvic floor, please go see a pelvic floor specialist so that you can start resolving that. The first thing that we need to get is diagnosis. Now, the process of diagnosing pelvic floor concerns typically involves taking a thorough medical history and conducting a physical exam. According to American College of Obstetricians and Gynecologists, during the physical exam, the healthcare provider may examine the pelvic area that will include vagina, uterus with a cervix, and check for any kind of abnormalities or signs of pelvic floor dysfunction. And if that's enough, they're not going to go deeper. They will refer you to pelvic floor physical therapist if they're educated enough or if you ask them. Okay. So at this point, I'm going to say don't just seek help and go to the doctor, continue seeking help. So ask them, would this warrant a visit to the pelvic floor physical therapist? Do I have anything to lose if I go and see them? That would be the best question to ask. So I'm going to teach you a little trick here because a lot of the times they will say, well, you know, it's normal. Oh, well, you're aging. Well, it's this or that, any of the other, causes that we mentioned earlier. And you could not get the treatment that you deserve to get. Unfortunately, this happens to 3 out of 10 women. Okay. So 3 out of 10 women that will see the doctor and ask to get help will be dismissed. So you don't want to be those 3 women, like one of those 3 women. You want to be one of the 7 that got to see a specialist and get the help that she deserves. Yeah. So that will be the first tip. Now, if we're not responding to anything that the doctor provided. Sometimes, they will diagnose you and they can provide medication, either muscle relaxants or, if we're constipated all the time, we can get laxatives or we can use some kind of natural treatments for that too. Hydrate more, eat more fiber, and so on. Um, if these things are not resolving and you've seen a pelvic floor physical therapist, then they may decide to do some more tests and studies. So that will help them really pinpoint to what the source is. They will do urodynamics testing to assess bladder and urethral function, while imaging studies such as ultrasound, CT scan, MRI may be used to visualize the pelvic organs and assess any kind of anatomical abnormalities. Now, these tests may be particularly useful in cases such as pelvic organ prolapse or if a patient doesn't respond to initial treatments. I've mentioned that you want to go see a physical therapist, and this is the point where I will stress that they need to be specialized in pelvic floor, not neurology, not ortho. I mean, all of that helps. Of course, it does, but they need to specialize in pelvic floor. And this is where they might, during the diagnosing process and setting up your personalized plan of treatment, they might use also an ultrasound, they might use biofeedback, just so that they can figure out how your muscles are responding, what is their muscle tone, what is the strength, and the activation of the fast twitch muscles. So, a lot of you have been commenting and asking, you've been saying, I sneeze and I leak, or I jump on a trampoline and I leak. Well, this is where they want to check those fast twitching muscles and make sure that you're getting the right kind of customized program for your specific needs, right? Now, it's worth noting that some pelvic floor concerns, such as pelvic pain, may be more challenging to diagnose due to the complex nature of the condition, and we covered that earlier. So, in these cases, a multidisciplinary approach will involve specialists, such as in urology or gynecology, or a combo. Urogynecologist would be a person to see, and pain management may be necessary to accurately diagnose and treat the underlying conditions. It's important for everyone to speak with their healthcare provider about any kind of symptoms and concerns that they might have, as early diagnosis, trust me, early diagnosis and treatment can lead to the best outcomes. Now, I mentioned that we need to sometimes involve several specialists just so that we can start resolving any kind of issues that we have. So, what we want to do is make sure that if there are any kind of coexisting conditions, that we can address those, such as endometriosis, pelvic or abdominal scar tissue, ovarian cysts. Any of those situations need to be addressed and resolved. I've mentioned that medication therapy is often prescribed, such as anti inflammatories, muscle relaxants, vaginal estrogen, anesthetic gels, sometimes even Botox to help relax those over tight muscles. Now, some antidepressants are used to affect the way pain is processed by our nervous system. And in addition, anxiety and depression can result in muscle tension. Therefore, decreasing psychological stress will help to relieve pelvic muscle tension too. Occasionally, actual injections of medication into the muscles themselves will help make diagnosis a little bit easier to make, and also prepare the muscles for physical therapy work. Because at the end of the day, you don't want to be spending $200, $300 per visit if you're not covered by insurance, um, and then not be able to work on anything with a therapist because you can relax and then feel bad about yourself. So it's not you. I know you would want to be healthy, but sometimes you need a little additional support. Personal development, life coaching, trauma resolution, sometimes even counseling with cognitive behavioral therapy have been demonstrated to be extremely helpful for women. These can and will help identify stress or psychological triggers that result in tightening of the pelvic floor muscles. Sometimes we need to really dig deeper so that we can figure out what the cause of that is. And a patient can really learn to break the cycle by consciously relaxing the muscles in response to those triggering events when it's done by under guidance, right? In addition, if pelvic pain is associated with physical or sexual abuse, counseling may help begin healing of psychological trauma, because everyone deserves to heal. So, sometimes we deny ourselves these options, and we as women tend to do that so often. So, I'm going to pause here and just kindly ask you that if you know someone struggling because of trauma, please help them recognize the need to see someone to get the help that they deserve. If they can't give themselves the permission, will you please be that person that gives them the permission to work through pain, because they're worth it and they deserve to live their life fully. And if you are that person, let me give you the permission to work through it. You deserve it. You are so worth it. I will advise that after you've done all these steps, that you continue. Because as I mentioned with my 10-pounder baby, it never stops. These muscles, as they told us in physical therapy all the time, like all those years, it was use it or lose it, use it or lose it. And we could see that as such an amazing example with our professors. I mean, they were ready to retire, some of them, and they just knew exactly where everything was and how it was functioning. They were really in tune with their body. And so you can't always continue through physical therapy and going to the doctor all the time. You do that when it's the most acute, when it's the worst, when you really have to get that professional guidance. And yes, for some, it's going to take a few weeks. For some, it's going to take 6 months. For some, a year. But then or alongside that, not just necessarily right after that, but alongside that, you want to think about a home exercise program, something that you do by yourself every day or a few times a week at least, consistently, so that you can help support your progress. And now we get to the prevention, the amazing part. I've talked about so many difficult things, and I know it's not always easy to see all that, to hear all that, but hey, we need to talk about it, right? We need to start talking about it. But the beautiful part of that is if I know that my uterus wants to bulge, if I know that my bladder wants to leak, if I know that I have certain issues, yes, I'm getting into that TMI as I mentioned earlier, then I also know that there are ways to prevent from all of that really happening to me or repeating itself. And I can do that through a 360 approach. And this is what I advise to everyone. We want to live in that healthy body so that we can be active, so that it helps us prevent the constipation. So when we're active, our bowels are working better. And how else can we support the bowel movement? Well, by regular balanced meals, plenty of fiber. And of course, fiber and the bowel movement need water. It all intertwines, right? Plenty of hydration is going to help us feel better. There will be less headaches, less pain, less associated pain. And of course, if we can, for the time being, when we're experiencing any kind of symptoms, avoid certain irritants that I talk about in the guide. Wink, wink. You want to go to the Facebook group and download that guide. You want to avoid those irritants just for the time being. And if you can't really avoid them, can you limit them so that you can help yourself to achieve that 360 approach of the best possible prevention? I've talked about pelvic floor exercises. Now, if I'm leaking right now, or if I've just had a baby, I'm definitely going to avoid high impact sports. I'll do something that's gentle and kind to my body that helps me focus and connect with it and activate all the right areas so that later on I can build up on that and get back to high impact sports if I enjoy them. We need to seek help on time. I think we all understand that by now. And this is how we get this 360 approach. But the most important thing, and I placed it under the pelvic floor exercises, but I think it applies to all facets of our life, is that we need to be consistent more than we need to be perfect. There is no perfection. We cannot be 100% all the time, but can we be consistent? If I make a goal to work on my pelvic floor 5 times a week, can I achieve that? Absolutely. Can I sit in the car line as I'm waiting to pick up my boys and focus on my front pelvic floor? Yes. Is it too tight? Is it weak? Can I do something about it? Is there an exercise that I could do to either relax or strengthen it? Yes, I absolutely can. So, are you interested in joining me in a little exercise here? We're going to do more in the 5 day mini course. And then, of course, in the 8 week program, we really dive deep and we do a lot more. But if you're ready, this is something that you can do whether you're waiting at the red light or car line or anywhere that you're sitting or lying down on your side in your chair. Either way, standing up, you can always do that. For the sake of this masterclass, I'm going to assume that we're all sitting because I'm sitting. So I'm going to sit up tall in my chair, relax the shoulders down, shoulder blades are almost touching. I'm going to breathe deep towards my pubic bone, my pelvic floor, and I will exhale and allow the pelvic floor to lift as I'm exhaling. But what I will do with the next exhale, I'm going to imagine that I put on, when we were like 16 and had the low rise skinny jeans. Oh God, I hated them. Not the low rise, right? And you had to zip them from pubic bone up to the end of that zipper. And that didn't go all the way up to the belly button. It just went halfway through, right? So that's what we're going to imagine right now. We're going to take a deep breath into the pelvic floor. As I'm exhaling, I'm zipping that skinny jean up and it's low rise. So the bottom, the lower abdomen is kind of tucking in and I hold it in. My belly button is relaxed. I'm breathing as I'm holding. Sounds weird, right? And I relax. So now I know that my belly button doesn't really move. I don't suck it in as they used to teach us. I'm just gonna zip the low rise jeans. Let's do it again. Deep breath in. As I exhale, I'm zipping up from the pubic bone to the edge of that low rise jeans. Lower abdomen comes in and I hold it. I try to breathe. How do I do that while holding? Well, you can count. Three, two, one, and relax. There you go. So that was one of the exercises, and we're going to talk about how and when to use them too. We're coming to the end. Whether you were watching the replay or joining me here live, get ready for all of your questions, and I'll be answering them in just a minute. But let me tell you a little bit more about what's coming up. You saw the master class. I'm really hoping that we covered all the bases, that I really gave you all the empowerment that you need to seek help, to get referrals to physical therapists, because I don't necessarily work with people who have really severe issues and need to see someone in person to help them start resolving them. I have denied a few people into the program until we hear from the surgeons, from the doctors, from the physios that they can continue in their home based program. And this is where I'm happy to welcome them back in. But you got everything that you needed, all the information, the causes, the symptoms. We laid the foundation on how to talk to your health team, how to advocate for yourself, how to support another woman that might be struggling with these symptoms. That was the masterclass. Then we're going to go into the 5-day mini course, free access. We get to learn more. I will ask you more questions. I will ask you to send me in your current concerns so that I can customize it to your needs even more, because if there are a lot of similar topics, I'm happy to do an extra video with extra prompts for you. I'm happy to create another PDF that you can download, just like the guide that you get after this masterclass. So we're going to learn a lot about our bodies. We're going to learn how to assess what's going on with us. Someone asked me, how do I know if I'm incontinent? Well, we'll talk about that. We'll use trackers. You will be able to implement everything that you learn in those 5 days and track. And as you're tracking, I'll also teach you what to do. And you will be able to track the progress from that too. In the meantime, you will get to connect with our tribe, with our amazing tribe. And then on day 5, guess what? We expect to see some results. We expect to see some kind of progress. The tiny little steps, the tiny little things that can happen even in short period as 5 days, in that short time, because hey, it's been proven through research that if we start implementing the right kind of exercises at the right time, if we know when to activate, when to relax, how to do that depending on our current condition, we can also provide the right type of exercises, the very basic ones that you need, the foundation, and you can achieve progress in as short as 5 days. How amazing is that? And that's what I want to celebrate with you. And I hope you're willing to celebrate that with everyone else too, their progress too. On day 5, I will talk to you about the 8-week course because some things don't resolve in 5 days. Some things, like I said, some situations will take a year and it may take more effort, such as the beautiful lady that I met a few months ago. And she mentioned that she was experiencing prolapse from all 3 organs through bladder, uterus, and rectum, and that she was scheduled for surgery the week or two after, and she never got the referral to physical therapy. I wanted to cry because I knew I couldn't see her because it's a home based program and she really needed someone hands on, someone to really take her through every single step. And she never got the referral that she deserved to get. A proactive woman, someone who's always done everything to help herself, would go to the gym and struggled in the gym because the her body was not responding. It was sending all the wrong, all the red flags, all the alarms, all the wrong signals. And she felt stressed because, she was working so hard for herself and with very little result, actually, with quite a lot of damage. And so we want everyone to get the exact support that they need. So sometimes I will be straightforward and say, hey, you're not ready for our program just yet. Let's get cleared by the surgeon or physio. I'm happy to talk to them too if you allow that. And once we get cleared, then they will say, you're finishing up here. You need to find an option for yourself so that, use it or lose it so that you can use it and benefit from that and be diaper free for as long as possible. Before I head into the Q&A section, let me just remind us all. We've been told so many times that our situation may be frequent and common, and they would equate that with normal. And I would like to just stress that no, just because things happen to so many of us, even up to 70% of women experience pelvic floor dysfunction at certain point in life, whether 20 or 89. It doesn't make it normal. We deserve to be diaper free, pain free. I absolutely believe that a healthier, happier pelvic floor is possible for everybody and must become the norm. So let's raise the standard. So, as sunflowers, we look up to the sun and we absorb the energy and we thrive and we help everyone around us. But when we're not getting that sun, when the clouds are coming in, let's be those sunflowers. They like to turn towards one another and they support one another so that they survive the storms and the bad weather. All right. I hope that inspired some of you. So let me start with the questions. There are quite a few. And because some of them fall into the same kind of group, I'm just going to merge those for the time's sake. I really want to respect your time. I appreciate you, whether you're here right now live. Thank you so much for taking the time, whether you're watching the replay and getting some valuable information for yourself. So let's start with the first one. I would just like to know best exercises and patterns to follow as I age. So, we were talking about prevention, and I hope you got to take some notes. And, I need to take a sip of water. I hope you can do that too. Excuse me. All right. So, when we talk about prevention, we did say healthy nutrition, healthy, active, balanced lifestyle. This is something that you're going to find to be a common thread for all of those centennials. They socialize, they meet with one another, they find ways to laugh, they will read, they will keep their brain and bodies busy all the time. And that's something that you want to do too. If your body is able, go for regular walks every single day. That's amazing. You're getting that oxygen, you're getting the blood flow through your body. And if it's fast paced, I promise you that your pelvic floor is responding too. So, just starting with that. And if you can build up on that, any kind of strengthening exercise will be extremely beneficial too. Now, the patterns that we want to follow as we age. So, something um, I don't know if you were ever told that as a girl, they would tell you, don't sit on cold floor and don't throw yourself down on a hard surface. And I remember certain times, when you misestimate how deep the chair is or a bench, and you just kind of fall down and things kind of shake up from within and you don't feel comfortable. Well, that's all the ligaments holding up your uterus and all your organs that are kind of protesting. They're going, oh, I don't like that. So you want to avoid any kind of those sudden aggressive moves that will upset your ligaments, if I can say that. So, unlike muscles, muscles will, you can contract them, you can relax them, and you can stretch them, and then they will go back to their form. The ligaments don't really do that. They're not that elastic. So, we want to pay attention to them. So, if that's a pattern that you want to follow, so to just gently, ladylike, sit down, be, nice with your body, respect it, love it, feed it with that love and care. Next thing, let's see, next question. What are daily things I can do to strengthen it and eliminate leaking when jumping? And let me go down. When I cough, I sometimes leak. So that's another leak. Would love to have a strong pelvic floor. And then leaking when jumping, even after giving birth, but my kids are already 10 and 12. And then another question that's very similar is, how can I stop leaking with a sneeze, laugh, or jump? How can I keep it from happening more frequently? All right. So I'm merging all of these into one answer because you can see that I like to give long answers sometimes. And again, want to be mindful of your time. So I think we covered a lot of that right here. When we're leaking, it's quite likely that those front pelvic floor muscles are quite weak. That doesn't mean that the entire pelvic floor is weak. Maybe the other part is too strong. We don't know. We want to create a balance in the entire pelvic floor area. And we want to retrain the bladder also. So if there's this strong need to urgently go to bathroom, or we need to run a bathroom just in case, oh, we need to leave the house, so I need to go because I don't want to leak. We want to strengthen the pelvic floor muscles, but we also want to retrain the bladder so that it doesn't send that signal that we need to pee all the time. So that's what we can do with regular exercises. And like I said, not every exercise is going to be for every person. And I want to touch on that as much as possible in the 5-day mini course. So make sure that you stay tuned, that you're in the group and you can still get access to all of that. Like I said, it's free of charge. You're mentioning that your kids are 10 and 12, and I would like to say it doesn't matter if they're 30 or 40, you can still work, well, 30 and 32, right? In your case, you can always work on the muscles. There's this beautiful thing that they call muscle memory. Let's take advantage of that, right? These muscles used to be strong, and we didn't even know that they're strong. We didn't even know that we had them until somebody started talking about them, or until you started sneezing, and now they call that peasing, and it's not a professional term, although you're going to see it on my social media. But things started to normalize and we started talking about pelvic floor. But you can strengthen those pelvic floor muscles to the point that you don't have to think, oh, I'm going to sneeze, I need to activate them. You can retrain those fast twitch muscles, fast twitch fibers of the muscle to activate without you controlling that all the time, because it can be stressful if you need to think about it all the time, right? And you do want to get back to your regular activities. So, yes, you can do that anytime, whether you've just had a baby recently and you've been cleared to exercise or later on. Why don't Kegels work? Okay, here I really want to learn more about you. I want to know what's going on exactly. What are the symptoms that you're experiencing? Because, yes, there are certain situations where Kegels will not work, and you actually should not be doing them. And I'm embarrassed to admit, but this is how it was 20 years ago. We were actually told that we as physios, we need to be fit and we need to have great fit bodies and amazing muscles and responsiveness and all that. That before we get up in the morning, this is what the teacher told us, the professor. She said, you're going to wake up, open your eyes. You will activate your pelvic floor. You're going to zip that zipper that I told you about earlier. You're going to activate, pull in your pelvic floor, turn to the side, roll out of bed, and you're going to hold that pelvic floor throughout the day until you go to bed in the evening. And that's where you're going to first lie down on your side, roll back on your back, and that's when you release the pelvic floor muscles. And I can promise you that that was not not something that we teach nowadays. We don't say that to anyone anymore because thanks to you being open, thanks to you being willing to try all these things out and being able to provide feedback and say, this is not working for me. I actually experienced the same kind of issues or even more. We were able to dive in. Well, not me necessarily, I'm not the researcher, but there has been so much research published in the past 10, 15 years that explains that there are certain conditions where you absolutely do not want to activate those muscles more. What you want to do is create a balance in the pelvic floor. You want to know how to relax those muscles that are too tense. So strengthening them more and keeping them tight all day might make the situation work worse. And you will say, my kegels didn't work. And we're blessed nowadays that things have moved ahead, that we have advanced, where we can recognize when and where we should be doing the kegels and when we shouldn't. We talked about what's causing incontinence, so I'm not going to go through that. When does course begin? So the 5-day mini course begins right away. Feel free to either DM me and you can explain your situation a little bit more if you feel comfortable, so that I can customize the instructions to your need. And then, yes, the 8-week course is coming up, but stay tuned. Make sure that we're not going to your spam in your email, so that you can find out when we're launching the 8-week course. I will notify you about that, I promise. Mm, okay. Does it ever stop? Absolutely. Hun, it does. We just need to be consistent. That's all I said. You don't have to be perfect, but we just need to be consistent and we can actually make it stop. Mm, okay. So let's go to the last question, and that will be, how long does it take to re-strengthen pelvic floor muscles post childbirth? You just had a baby. First of all, congratulations. I hope you and the baby are doing good. I hope everybody's adapting to the new way of life. So, congratulations to you all. I wish you a good, speedy recovery and the happiest, the healthiest baby in the world. When it comes to re strengthening the pelvic floor muscles, you heard me talk about closing that zipper. You can do that right away. Like you can literally deliver the baby and do that exercise, but also know when to relax, right? Your body has gone through a shock. People will say it's a blessed experience and all that, but let's just admit it, that is trauma to the body. The way we experience the level of pain that we can experience, the discomfort, the not knowing, but still going through it, releasing to it and letting our body do what it needs to do, and, having medical help available if and when we need to. Um, but yes, you can start with the pelvic floor exercises right away. We can do those, um, as long as we're not applying too much pressure or the right kind or the wrong kind of pressure. And the same will apply post surgery. So you want to follow the advice of your pelvic floor specialist, your surgeon, or your OBGYN, and you can always ask them, right? So you don't have to do everything that I say, but you can take the information that you're getting here or online from other people, and you can verify that with your healthcare provider. And you can say, I have been advised to do this and this. Is this okay for me? So you always want to get cleared. And once you get clear, then you can build up on that. So once you say, okay, I've done the basic pelvic floor exercises, I want to build up on top of that. They have cleared me. This is when we can go deeper and just add an extra layer. And there's always the next level, right? We can always do that. But feel free to work on your pelvic floor muscles. You want to know that you can create that contraction, that you can control your gas. Let's say if you get gassy, can I hold it in or can I release? If my anus is too tight, can I release? You don't want too much contraction, especially if you've had episiotomy, but you want to be able to connect to those areas. And then when you're relaxing, like which areas are feeling very tight at the moment, which areas should get more relaxation and which one should get more strengthening and activation. And then, what I would like to recommend, any of you that are planning to have babies, maybe you've already had some, maybe you want to have some more, maybe this is the first child that you're getting ready for, start with pelvic floor exercises right now, if you can. If you know that you're heading into a procedure because there is something that you need to resolve, either around your rectal area, uterus, bladder, any area that's going to require a surgery, it will create a shock to your system where your brain will disconnect from your muscles. Maybe that's just a way of protecting itself, so that you don't go nuts because that is a shock. There is pain. There is, ideally you wouldn't want to allow that, right? So it goes against nature, I will say, but sometimes we absolutely need it. And if you know that you need it, you've been told so by the professionals, then go, of course, and do it. But do advocate for yourself, get into pelvic floor physical therapy, or start a home based program as soon as you can so that you can learn certain things like how to manage your pressure. What can you do before the surgery? What are you allowed and absolutely not allowed to do right after the surgery? What can you do 6 weeks after once the surgeon or the doctor clears you? What are those things that you can do? So, if you know that I'm going to get back to getting pregnant. If you know that you're going to have a baby, you want to strengthen your body. You want to get that good blood flow circulation. You want to do your regular walks, or if you used to love going to the gym, do that. Be active, be fit. Of course, everything as it should go during the pregnancy. You don't want to overdo it, but you do want to continue being active because it's going to ease the delivery, but also it's going to make your rehab a lot better. You will, they like to say bounce back. I don't really believe in bouncing back. I feel like we're upgrading to this different level because everything is different. And yes, we can reclaim our muscles, the strength, and all that, but not necessarily everything needs to be the same, right? We're a different person now. Like we have a baby now, or we've stopped the high athlete, professional athlete career. Now we're heading into this new chapter of life. Okay, we've been overtraining our body for such a long period of time. Now we're transitioning into something that could be a little bit more normal, something more sustainable that we could do for life. So, what are we going to do with that? So, being active, taking care of our bodies, the 360 way that we mentioned earlier, getting enough hydration, enough sleep, the right kind of nutrition, preventing constipation, activating the right kind of muscles so that even when we don't think about it, they're there to do their part. That's what you want to do. Okay, that was a very long response, and you've been very patient with me. So, as we're wrapping up, again, to recap, we've built with the basic building blocks. We got to learn the fact. You got to meet me, your personal health coach, for this day, for this masterclass. We got to identify some symptoms, and you got to get that encouragement to advocate for yourself always and everywhere. And I would like to invite you to the PelviGain mini course for the next 5 days, where we can do a little bit more, get to know each other a little bit more, and connect, and then celebrate and choose our next step, whether you want to continue with me with the home based program, or if you want to continue knowing that you need to go to the pelvic floor physical therapist and start laying the foundation there, really customized to your needs, and then come back when you're ready if you want to. But most of all, as Women's Tribe, because you are part of the Women's Tribe, let's share the knowledge. Let's help each other out. Let's empower every single woman so that everybody gets to experience the benefits of what you just learned today and everything that we shared here. So it's only onward and upwards from now on. Thank you for spending your valuable time with me. My name is Susanna. I was your personal health coach during this masterclass, and this is where you can find me, find us, connect if you want to. Shoot me a DM or an email, or just stay in touch and make sure that you're up to date with everything that we're doing. And if you have any particular questions, as Women's Tribe, you're here, you're helping us shape this into everything that you need it to be. We're here to serve you. So thank you for today. I'd like to say good night, goodbye, wherever you are in the world. I know Faye is saying goodbye from the other end too. Thank you for your help, Faye. And we'll chat more inside the Facebook group. Until then, good luck and to your health.